Hi, I'm Dr. Don Bonner with Personalized Wellness. Today I want to do a little talk on genetic testing. And again, this is kind of an impromptu talk. I hadn't really planned to do this, but I've just noticed numerous websites that offer genetic testing, different doctor's offices and nutritionists, all sorts of people are offering genetic testing. And I want to make sure that you as a patient understand what these tests mean and what the interpretations mean. And what I think you really need to be careful about is getting one of these tests. They tell you have a genetic SNP, and that all we have to do is give you this supplement and give you a lot of it, and it's going to take care of your problems and you're going to feel 100% better. So what I want you to understand is exactly what it is that we're testing for and what it means when you get these reports back. So I did a little diagram here to just give you a basic understanding of what we're looking at. These genes that you get back that have a SNP to them oftentimes code for an enzyme. And when they code for this enzyme, it can cause this enzyme to be sped up or slowed down. And what these enzymes do, they convert one thing to another. So a substrate to a product. So this might be homocysteine being converted back to methionine. This may be the MAR enzyme. The thing I want you to really understand is that even if you have this genetic SNP and it, say, slows this enzyme down, it may not mean anything because that really is only about 10% of what goes into this functioning. The other 90% comes from what we call the exposome, or things that act on this enzyme. And those things in particular could be cofactors. So enzymes need certain basic building blocks that we call cofactors to work appropriately. Oftentimes those are vitamins and minerals. So this might be vitamin B6, or it could be magnesium or zinc. And so this enzyme needs that cofactor to work appropriately. Or you could have what are called inhibitors. And inhibitors are things that slow this enzyme down, make it not work as effectively. So that could be, it could be stress, it could be inflammation, interleukin-6. There's numerous things that could cause this enzyme to not work very well. Then you also have promoters, which are different things that actually help the enzyme to work better and more efficiently. So really, just knowing the genetic SNP is not enough. You have to know all of these other things. And that's why I have this, I don't know if you can see it or not, this big poster behind me, which has numerous biochemical pathways with many, many enzymes in there, with all of their cofactors, promoters, and inhibitors. So if we get a genetic SNP back that says, say it's MAO-A, and you have a genetic SNP that slows this enzyme down. Well, first thing I'm going to look at, are there any cofactors that this enzyme needs to function appropriately? So say it needs zinc and B6. Well, I'm going to make sure your zinc and B6 levels are adequate before I do anything else with this genetic SNP. I'm also going to look at inhibitors. What else could inhibit this? So is inflammation a big deal? And say your highly sensitive CRP is 10. Well, that's going to really slow this enzyme down, and that by addressing this inflammation, I help you more than by just addressing this genetic SNP. So as you can see, there's a lot more that goes into this than just looking to see what genetic SNP you have and then giving you a supplement. Another perfect example of this is methylation. I think most people have heard of the MTHFR gene. So you can be, say you're homozygous, you get a report back and it says you're homozygous for MTHFR C6770. And that means that enzyme is decreased in efficiency by 50 to 60%. So somebody recommends to you, well, all you have to do is take big doses of 5-methyltetrahydrofolate. Everything's going to be fine. Well, the problem with that is you can actually over-methylate. Over-methylation can be just as bad as being under-methylated. So it's kind of a Goldilocks syndrome. You need to be somewhere in between. And you've got to be really careful with what you do as far as, overdoing these supplements. So I'm a big believer in giving the body what it needs to take care of these things more on its own than for us to be pushing the systems by things like 5-methyltetrahydrofolate. So, and that's not saying that I'm against giving 5-methyltetrahydrofolate. I mean, if your homocysteine levels are high, I'm going to give it to you. I'm going to give you methyl B12. I may give you adenylyl B12. I mean, give you a lot of different things to decrease that homocysteine level. But I think you need to understand what you're doing, and you really need to understand what else can be affecting this enzyme. So again, it's kind of my, not a public service announcement, it's kind of a patient service announcement. So just be careful when you get those reports back. Be a little skeptical of recommendations, and that's it. So I appreciate you listening to the video, or watching the video rather, and if you have any questions, check out our website. We still offer a free phone consultation, so give us a call and come by and see us. Thank you.